I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor. In this video, we're going to talk about something crucial yet often overlooked: wrist injuries and the long-term consequences. So in my clinical practice, I've encountered numerous patients where they have had a wrist injury in the past and they overlook the wrist injury, they overlook the pain, and the pain subsides temporarily except that it comes back after months or years later. And at that time when I see them in the office, the long-term damage has already happened. So let us take a quick look at the anatomy of the wrist to understand why that happens. So the wrist is formed by two forearm bones, the ulna and the radius, and they connect with the carpal bones. These connections are maintained through ligaments which are crucial for proper alignment and joint functionality. So during a wrist injury, so one might injure the radius bone, which is this bone here. So let us say if the injury was pretty severe, then there's an obvious fracture, there's going to be deformity, and then they would go to the doctor and then they're going to get treated. But sometimes the injuries can be very subtle. They can have just some mild swelling here, they can have pain, and they may feel like it's going to get better, and it may get better after like 4 to 5 weeks or so. But let us say if that subtle injury was involving the joint. So let's say there's a subtle fracture that is involving the joint, and because they did not get the proper attention to this injury, they may not heal correctly. And when they don't heal correctly, then that's going to increase the risk for long-term complications like arthritis. So there's another bone called as the scaphoid bone. So scaphoid bone is a bone just right here. It's a carpal bone that lies above the radius bone. And this particular bone, they do not have a proper blood supply. So what that means is that if someone encounters a fracture in this bone here, so this fracture may not heal properly without the proper treatment, and if it doesn't heal properly, that's going to increase the risk for arthritis in the future. And this can cause chronic pain, disability that arises from this complication of arthritis. So there are also ligaments that connect the carpal bones that are important for proper alignment and function. So for example, there is a ligament that connects the scaphoid bone and the lunate bone here. And again, with a wrist injury, that ligament can get damaged, and thereby, if not treated properly, that can also increase risk for complication of arthritis. So that's why it's important not to overlook these injuries. And it's also important to make sure that you consult the right healthcare provider. Sometimes just an X-ray alone is not enough. A thorough clinical examination is important to make sure that subtle injuries are not missed. And for someone to do a thorough clinical examination, the healthcare provider should be well versed with the intricate anatomy of the wrist. Because most of the time, when I'm doing a clinical examination of the wrist, the examination is what dictates what I want to do. So for example, if I'm worried about a scaphoid fracture or a scapholunate ligament injury, then I might not stop with x-rays. I might get special view x-rays, then I'll probably get an MRI or a CT scan, depending on my clinical suspicion. So even if you go to the doctor and if the doctor does not know the intricate anatomy of the wrist, the subtle injuries can be missed, thereby increasing the risk for long-term complications as well. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. Please share this video with others so that others can be benefited as well. And I'll see you in my next video. Until then, goodbye.